Sexuality in old age, sex life after 60. This topic nowadays is still permeated by many myths and taboos, but it is a constant in the urologist's routine. Follow this video with me until the end, as I will bring you some interesting information that you can apply in your life or share with someone you know. Today, the fastest growing age group in Brazil is the elderly population. For some years now, we have been observing the inversion of the population pyramid, right? The narrowing of the base with the constant aging of the population. This aging of the population directly reflects the lifestyles of the elderly. Today's elderly, compared to the elderly of 30 years ago, have acquired very different lifestyle habits, and this directly reflects on their sexual life, on their sexuality. And when we talk about sexuality, obviously, we are not just talking about the sexual act, just intercourse itself. Sexuality is much broader. It includes all experiences related to sexual well-being. This is particularly important with aging because it is a set, right, of emotional connections, intimacy, and other forms of affection. According to the WHO, the World Health Organization, sexuality is influenced by an entire biopsychosocial framework, in addition to environmental and economic elements. In other words, it is a very complex subject. This is particularly true when we approach this topic in the life of the elderly. We know that the human body, the human machine, modifies itself over time. It is the natural process of aging, and our body was made for this. It undergoes age-specific adaptations. When we talk about the sexual life of the elderly, we have some challenges that need to be overcome, and often the patient needs medical help for this. Regarding, for example, the physical challenges. Most men over 50 will face erection difficulties, erectile dysfunction, at some point in their lives. Furthermore, there is decreased libido, which can be related to hormonal changes. Women, for instance, will experience an intense process of vaginal dryness and atrophy, which is very significant in the postmenopausal period. So, these are physical challenges that need to be managed with the help of a professional. In the case of women, the gynecologist, and in men, the urologist. Another challenge regarding this sexual issue for the elderly are those psychological barriers, those emotional factors that often directly influence the quality of sexual life. Here we can mention, for example, feelings, the acceptance of one's own body modifications, such as the onset of chronic diseases, other psychological distress, for instance, like the loss of a partner. Social isolation itself. Nowadays, in society, we observe what is very common, the isolation of the elderly. This can directly influence, especially in men who have a greater tendency to live in isolation, the quality of their sexual life. It is important for us to make it clear to the patient that each individual is unique. Each one has their special and individual needs. While in fact some women choose to have a more active sexual life, others manage to transform this into other forms of sexuality, into other forms of connection, of intimacy. What we also need to make clear to the patient is that, indeed, they will not go back to being a 30-year-old. However, they can be their best version at 70, 80, 90 years old. Nowadays, we see many patients in the office who are 90, 100 years old with incredible quality of life, directly related to lifestyle habits. And here, when we talk about sexual life, this plays a very important role. So folks, something I often tell my patients are 5 pieces of advice. And in fact, the urologist is the last part of this. First, regular sleep, need for sleep, 8 hours a day. Second, diet, nutrition. Third, habit of drinking water, hydration. Fourth, physical activity, exercise. And finally, medical help. Of course, the professional, the urologist or gynecologist in the case of women, will have a fundamental role in managing these issues. For example, with erectile dysfunction, which arises as a consequence of various diseases, for instance, cardiovascular disease, diabetes, hypertension, chronic kidney failure, it can be related to these conditions. We can indeed offer treatment, both medicinal, such as injections to be used during intercourse, and often the use of implants. Some elderly patients adapt well to this type of treatment for erectile dysfunction. This is what we need to offer to try to help in this regard. Another thing is in relation to libido. It is normal for libido to change. It is normal for a couple's interest to change, especially after years of relationship. We can help, either with sexual therapy or, for example, hormone replacement therapy. Sometimes the patient is in a state of discouragement, a state of low drive, thinking it is their own fault, and in fact what they have is a hormonal disorder. We need to investigate testosterone levels, investigate thyroid function, and the existence of chronic diseases. Regarding the female aspect, it is not something the urologist addresses, but it is also up to the doctor to provide this counseling. It is very common for patients to arrive complaining, about the lack of interaction or their partner's lack of interest regarding sexual life. We can advise, obviously, but the gynecologist will manage this. Something I usually suggest to the patient's partners, for example, is the use of lubricants. Because after menopause, vaginal dryness causes atrophy, which can lead to a very uncomfortable situation during sexual intercourse. So this is sometimes a simple measure that helps a lot. If you are dissatisfied with the quality of your sexual life, with your sexual performance, do not fail to seek medical help. Do not fail to consult your urologist. Today we have several studies that already prove that patients over 60, 65 years old, satisfied with the quality of their sexual life, tend to age better, with better well-being. This is directly related to improved cognition, behavioral improvement, improved cardiovascular risk factors, improvement in chronic pain conditions, among other benefits. And listen, if you've made it this far, it's because this topic really matters to you. And that is already the first step. So before I finish, let me tell you something quickly. A group of scientists made a surprising discovery, a simple 100% natural 7-second daily habit that has helped thousands of men over 60 regain desire, potency, and even confidence when it counts, without needing medication, injections, or complicated procedures. If you feel that your performance isn't the same anymore, if your libido has decreased, or if your body doesn't respond like it used to, it is definitely worth seeing this. Point your cell phone camera now at this QR code here on the screen, or click on the link pinned in the first comment below. This video can open a new phase in your sexual life, a more active, more confident, and much more satisfying phase, both for you and your partner. Take the next step. You deserve to live this again. Best regards, and until next time.